Hi, Dr. Joe.
Hi.
I have a concern today. It's regarding my pain on the right side of my neck going down to my shoulder and collarbone. And it feels really tight and uncomfortable. So is there something that could be causing this?
So you feel the upper trap area and then the little front as well.
Yeah.
And then where the shoulder meets neck, this area?
Yes.
You feel discomfort? Yeah.
I do.
Only right side?
Only the right side.
Okay, so when we treat, release the upper trap, levator scapula, this area, we gotta think about the muscle imbalance. We gotta check the pec muscle area first. So, before treating here, I always check how much they can open their chest. So I check their chest open. If the pec is really tight, they cannot open the chest much. Then we gotta treat the front side muscle first. So let me introduce you about the muscle imbalance theory. When you see so this is the front side muscle. When your pec muscle, and then sometimes anterior deltoid muscle too. Anterior deltoid muscle, pec muscle, biceps muscle is getting tight, then shoulder is getting a little rounded. So when you see the side muscle here, this is a front, this is back, this is the humerus bone, shoulder bone. So when this front muscle getting really tight, that's pulling your shoulder forward. That's called a rounded shoulder. So if that's too tight, shoulder is going forward, then next your levator scapula muscle here and the upper trap muscle here, being tense. Yeah. So when you are rounded, then this is automatically going up, so getting tense. Also, this is back of your shoulder. This is scapula muscle, upper trap, and then this is the rhomboid muscle here, between your spine and scapula. Those muscles are all getting tight. So first of all, we gotta release your pec muscle. We gotta massage this pec muscle, and then find a little where you have a muscle not trigger points. We gotta release there, and then we got the anterior deltoid and the biceps too. But the pec is most important. After releasing, then you can check chest is opening much more, and then you can check the tension of your upper trap and levator. Then it's usually much better, more than 50%. And then we can treat the upper levator, the scapula, and the upper trap. So that's the treatment protocol.
Yeah. Thank you.
Yes.
Hi, Dr. Joe.
Hi.
So is there anything I can do to release some tension and pain at home?
As I told you, we gotta release the front side muscle first. So I'm gonna show you how to release the pec muscle and then anterior deltoid muscle release. I'm gonna use the ball. The ball is a really good tool to release the self-massaging and then release trigger point release. So basic principle is you gotta find the knot. Usually that's the most sensitive spot, and then you gotta stay over there with some body weight. So I'm gonna show the right side pec muscle release. Put the ball there, and then you gotta put your body weight. I make my legs a little lunging position, and then I'm gonna a little bit lean over there. And then you can do a little squatting motion. You can go up and down or side to side, and then you just do a little massage, and then keep arrange modify the direction. Yeah. And then just try to find a little very sensitive area, and then just keep giving a little massage. And then when you find a very, very sensitive spot, I feel a little sensitive here, and I feel a little, when I press there, I feel a little shooting down, a little refrigerating sensation. That's usually the spot, trigger point. Then you stay there for 30 seconds, or if you can stay longer, yeah. So a little massage, and then find your spot, sensitive spot, and you stay there a little bit, yeah. If you feel too sensitive, you can put a little body weight, decrease your body weight by using your hands, less pressure. Yeah. So you stay there maybe 30 seconds, and then you can take a break a little bit, and then repeat again. You can go back to the same spot, yeah, until you feel less sensitive. So when I'm pressing here, I feel a little refrigerating sensation going down. That's the main spot. So you release there, and then usually there's a multiple spots. So you massage this different area, and then you find another spot, and you stay over there. So to keep doing that. So you can do the pec. You can also go a little more outside. That's anterior deltoid. So you can also search there. There's a biceps tendon too. So doing the same thing. When you find the spot, you stay over there. You can go side to side too. And then once you find a little sensitive spot, then you stay over there. And then the good spot, you're gonna feel a little reverting down sensation. Then you stay there 20-30 seconds or as long as you can, and then take a break several times until you feel less sensitive. Yeah.
Okay, thank you.
Yeah, that's the front side release. And then I'm gonna show the back side. You're gonna put the ball a little low, and then same thing, you gotta find the sensitive spot or tight spot, and then you gotta stay there. So you can go side to side, up and down, then you can feel a little tendon, little popping, and then try to find a little sensitive spot. And then if you want to put more pressure, you can do a little bridge motion, and then stay over there. Same thing. If you pinpoint tender spot and trigger point, you gotta feel a little going down, tension going down. That's the spot. Then you stay there, just keep breathing out, and then stay there. If you lift your buttocks up a little bit, then you can put a little more body weight, or you can rearrange the position, find a better, comfortable spot you can stay on. Yeah, and then stay. Yeah, I can feel a little tension going down. Yeah, that's the main spot. Okay, so you do that several times, 20-30 seconds, just keep going back until you feel better. And then when you feel it's a little loosen up and less sensation, then you can find another spot. That was for lateral scapula tendon muscle, upper trap, and then you can go to the rhomboid as well. Rhomboid is usually between the scapula border and the spine, so you can put the ball. I recommend putting a little low, and then you can use the squatting motion, and then keep rearrange the position. I can feel when I'm doing this, I can feel a little knot and a little painful, then I stay there. If that's painful, put a little less pressure with a little using your head back against the wall. Yeah. And then always breathe out and then feel, spot. Yeah, same thing. Just keep giving a pressure and then take a break several times until you feel better. Yeah, and then after that, you can feel a little soreness for 1-2 days. One day that's normal, but later on you should feel less pressure in your arm and then your shoulder. Yeah.
Okay.
After massaging your pec, you can do pec stretches. So first stretch is bend your elbow 90 degrees. Bend your elbow 90 degrees, and then you can put your hands on the corner of the door, and then you can, first of all, you turn your body the other way, and then you go forward. And then try to find a good angle, and then breathe out and relax. You can use the wall too. Put it over there, turn the other way, and then move your body forward. This one first. Second one is keep your elbow straight. Same thing, turn your body away, and then you move it forward. And then try to feel the maximum stretch. 30 seconds, 3 times each. You can do more reps. Yeah.